We are more than 2 months into the pandemic, and you still have lots of questions. So joining us with her guidance, her expertise, Dr. Taslim Nimji, an ER physician at Toronto's Humber River Hospital. Hello to you. And this first question that we have for you has felt like a bit of a moving target at times. Why are masks not yet mandatory for everyone?
Yeah, Andrew, that one's been confusing, I think, for a lot as we've moved to different responses over the course of this pandemic. And the reality is in the past, when we've looked at the evidence around universal masking, and so this is masking in non-healthcare settings, the data has shown that it's not tremendously useful. So we started from that point. And then as we've sort of progressed and looked at whether or not we move to masking in the public, when we look at the use of cloth masks, we're using different materials. We can't really speak to the filtration of the material of the mask and how useful that is. And then there's also the concern about people who are not using really immaculate hand hygiene and using masks may contaminate themselves when taking on and off of a mask. So the answer is unfortunately not straightforward as to yes, we should and no, we shouldn't. And I think that we wouldn't be right either way or wrong either way. And so that's why you've seen a bit of an evolution there.
Here's another question I hear an awful lot. How do I differentiate between COVID-19 symptoms and seasonal allergies or a cold?
Yeah, so a cold and seasonal allergies are really more upper respiratory symptoms. So that's that runny nose. Maybe you have some itchy, watery eyes if this is allergy. You may have some itching or uncomfortable sort of feeling in your throat if this is a cold, and certainly if this is seasonal allergies. Whereas when you're looking at the COVID-19 infection, you have lower respiratory involvement. So you have shortness of breath, you have severe cough, which you're just not going to see if this is seasonal allergies for sure, or if this is a cold, which is a big difference.
Right, but are the upper respiratory symptoms a bit of a precursor to those kind of chest congestion issues?
So they can be. So the advice that we really say is if you have seasonal allergies, for example, and you get them every year at around this time and you're having the same symptoms, then the likelihood is that that's what it is. And if you reach for your antihistamine and you're feeling better, then that's probably where that can stop. And if you're having symptoms of a cold, certainly you want to exercise all of the precautions that you would to not be able to spread that cold and watch as those symptoms evolve to see if you do develop some of the other symptoms that we would be more concerned about.
Okay. Dr. Nimji, always good to talk to you. Thanks so much for your time.
My pleasure.